First, I'm going to speak a little bit to my colleague, Dr. Priya Patel, who has an interest in HPV or human papilloma virus. And Priya, maybe you want to talk a little bit about what is HPV and why does it matter?
So HPV, it's short for human papilloma virus, and it's a sexually transmitted virus. It's extremely common, and it's important because it can cause various diseases, some of which are commonly known as genital warts or certain types of cancers of the cervix, of the penis, of the vagina. So HPV is the virus that is linked to those things.
I'm sure there's folks sitting out there, not only here in the audience, but out in the general public saying, well, how do I know I have it?
For the couple of boys that are out here, there's no test for the boys, but for the females, we recommend that every woman gets an annual exam, and starting the age of 21, we do something called a pap smear, and the pap smear tests for changes to your cervix that, and also changes that would be related to HPV, and sometimes even directly tests for the HPV virus.
So if there's folks here Googling HPV right now and you see that it's coming up with 150 plus versions of it, are there any versions or types of HPV that matter more than others?
Yeah, so if you do Google, you'll see like well over 50 types, and they all are linked, like little kids get hand warts and things. These are all linked to HPV. The ones that we're sort of focusing on, there's a couple that you might see come up on Google, 16 and 18, and those are linked to cervical cancer, actually linked to about 70% of all of the cervical cancer worldwide is linked to these two types. So those are, I would say, the high-risk types. There are a couple, 6 and 11, that are linked most commonly to genital warts. And again, about 90% of genital warts come from the type 6 and 11. So there are certain types that are more consequential than others.
Since it's a sexually transmitted infection, I think some folks might have concerns about public facilities, locker rooms, borrowing a roommate's towel, what we call fomites. Can you speak a little bit to fomites and transmission of infection?
So this is, again, a sexually transmitted virus. It's from direct skin-to-skin contact or intercourse, including oral intercourse. It can cause oral cancers as well, but you won't get it from a public restroom or from sharing a towel or something like that. It's direct skin-to-skin contact.
Typically with your patients, what's your advice as far as prevention, and what conversations do you have about condoms as it relates to HPV?
So I always, in my opinion, say condoms are a good idea because it's the only thing that really prevents STDs. HPV, it can help prevent some part of the transmission, although the condom doesn't cover all of the skin. So because you can transmit HPV from just direct skin-to-skin contact, it's not going to be 100% preventative. So there are vaccines that are available that come to close to 100% prevention of HPV, especially if you get it before you've become sexually active. But even if you're already sexually active, it still can help prevent a lot of these high-risk types that we were talking about earlier.
You bring up the point of the vaccine, and probably some folks in the audience have had the vaccine, others may not have. And I think not justified, but there's a lot of conflicting information about vaccines and how good they are or not, or risky. What's your opinion and advice about the HPV vaccine?
In my opinion, it's black and white. It's a good idea to get it. The vaccines have been, over a lot of research, over a lot of people who've had them, been shown to be safe. They're tolerated well. Some people get like pain where the vaccine was for a day, or sometimes people get a little muscle ache there, but there isn't any serious side effects associated with it. And the benefits are very real, which is close to, like I said, if you've never been exposed to HPV, close to 97 to 100% prevention of some of the types that we talked about. Almost 90% of cervical cancers are caused by some of the 7 that I listed up on the slides. And the vaccine that's available in the United States, as of 2017, covers 9 of those types. So that would, in my opinion, it's clear that it's advised. And it's for women girls starting the age of 11 to 12. So a lot of pediatricians will have given it to their patients before they even come see us. But if you haven't, up until the age of 26, you can get it, and it's covered by insurance until then.
Yeah, I think I would even go one step further in that I think the HPV vaccine is to cervical cancer what the polio vaccine was to polio. And it could, in a generation or two, wipe out cervical cancer in industrialized nations if it's a well-applied public health strategy. But really is a remarkable vaccine and remarkable progress in our field in the last 15 years. Thank you, Dr. Patel. Obviously, as the name implies, these infections are transmitted through skin-to-skin contact, through mucosal membrane surfaces, so oral or anal or vaginal intercourse, and that's how they're transmitted. They can be either viral, bacterial, or what we call protozoan or parasitic. Risk factors: multiple sexual partners, same sex with somebody who already has a known STI, which wouldn't be really wise, but we have to mention that, or IV drug abusers also are known to be have a much higher risk factor for carrying sexually transmitted infections. The most common ones, as you can see, the menu of options here: chlamydia, gonorrhea, HPV, which Dr. Patel already discussed, herpes, trichomonas, syphilis, hepatitis B, and HIV. So chlamydia and gonorrhea, they're most common bacterial sexually transmitted infections. Trichomonas, which is more of a protozoan parasite, is actually the most common, but these two are the ones we worry about as gynecologists in young women. Unprotected sex, the women often come away with no symptom other than they might notice a little bit of a discharge, or their partner, if they're responsible, may give them a call saying they're having symptoms or they've been recently diagnosed. But the symptoms can be a yellow discharge, pain with urination, or bleeding in between periods. We can test this a variety of ways through a urine test nowadays, which wasn't available that long ago, or a vaginal culture. All women 25 and under should be treated. Simple treatments with antibiotics fix these things. And their sexual partners need to be treated as well. And usually we have to report these infections to the state. It's blinded. We don't give attribution to who had the infection, but it's a public health matter. It's important to treat these infections even if you're not having symptoms, because they could lead to fertility issues. Something called pelvic inflammatory disease, which can be an acute situation where a woman could have fever, lots of lower abdominal pain and cramping, like a really bad period that doesn't go away, riding in a car, going over bumps, you feel it. People can get quite sick with PID, or pelvic inflammatory disease. Usually the onset of this more serious complication is within 48 hours or so of sexual intercourse with unprotected sex. Treated promptly, usually you're fine, there's no sequela. If left unchecked, it could become an abscess, and you can get very sick, as well as it could damage your tubes and render you infertile. So real important just for your annual exams. If you're just carrying chlamydia that's untreated, you don't want to wait for the day where it starts as a lower urinary, lower pelvic infection, and ascends into what we call an upper pelvic infection, or PID. HPV, Dr. Patel covered this quite well. As I like to tell my patients when they ask about HPV, there's a royal family of HPV, about 14 different viruses that are the most virulent, and the king and the queen of that family is HPV 16 and 18. Those two are responsible for about 80% of all cervical cancers that develop. So that you're not scared, HPV is not real good at promoting cervical cancer. In other words, 70% of the population of US women have HPV by the time they're 30. A very small percentage of that population actually ever progress to more significant lesions on their cervix or cervical cancer. So not to be alarmed, but you should be informed and aware and get your checkups. Okay, herpes, a common cause for concern among the college population. There's types 1 and 2. A lot of times as kids, we may have had a little fever sore. That is herpes. Genital herpes is herpes type 2, but about 20% of genital herpes is type 1 because people have oral sex. So somebody with a fever sore in their mouth can have oral sex with somebody else in their genitals. That's where you get the flip-flop. The culture is important. The culture is the way we diagnose herpes also in the setting of clinical lesions. Usually they're little clear blisters that ulcerate, and they usually come back in the exact same spot because they live in the nerve. Somebody may draw a blood test on you and show antibodies in your blood to herpes. That doesn't mean you have clinical herpes. That means your body has been exposed to it, but you may have never manifested it. So it's an important distinction to make, because some folks may come in, they had a blood test by somebody and say, oh, I have herpes. Doesn't necessarily mean you have clinical genital herpes. The symptoms vary, but generally the presentation is you feel a little flu-like, feverish, and then you have these outbreaks of these clear blisters either on your genitals or around the lips or the mouth. And they last anywhere from a week to 2 weeks, very painful in the initial outbreak. There's an antiviral called Valtrex, and there's some others as well, that are fairly effective in not curing it, but reducing the symptoms and the time that the lesions are out. And then going forward in time, recurrent outbreaks tend to be in the same spot, and you tend to get a little warning. So if you can pop your Valtrex or antiviral, when you get the warning, it may stop the outbreak altogether or at least blunt it. Stress and sunlight are the number 1 and 2 causes for recurrent outbreaks. So final exams, you're studying out on the lawn of this beautiful campus. That could be enough to trigger a herpes outbreak because you're stressed for your finals and you're getting lots of ultraviolet rays from the sun. So note that well. Trichomonas, trick, known for short. Tough diagnosis to make. Basically, patients may come in with a foul-smelling discharge or just a discharge that gets foul-smelling after unprotected sex. It is very common, hard to diagnose. We do what we call wet mount. We look at under a microscope to look for these little tadpole-looking type bacteria that at 40 to 100 power we can sometimes see. Other times we're not so sure. There is a DNA probe test that we use now. It's been more helpful. But trichomonas is one of those what we call ping pong infections. If your partner doesn't get treated, and if your partner has another partner and doesn't stop visiting that partner, it's never going to go away. So it's just another good case for wearing condoms all the time. If you have a partner, no need for that partner to know you're on the pill. I'd say a pill and condoms is the best protection. The pill for prevention of pregnancy, the condom for prevention of pregnancy, and your own sexually transmitted infection. And then a single dose of something called Flagyl. This is the infection, but you have to know you have it and your partner should be informed. Syphilis, fortunately not something that common in a population in this demographic, but it is a serious infection. There's stories throughout history of leaders who did well until they had tertiary syphilis, which starts to attack your blood vessels and your brain, and you can go crazy. I think it was Al Capone was one of the most famous syphilis patients. But it starts with what we call a chancre, or a little like ulcer on your genitals. Usually it's a painless ulcer, and then that goes away, and then you can get, in the secondary stages, flu-like symptoms and a rash, and then it goes dormant for a while. During these first 3 stages, you tend to be still infectious if you have sex with somebody else. And then the late stage, or tertiary syphilis, is when people start to manage. They can have aortic aneurysms, they can have blindness, as well as they can become psychotic because it eats away at their brain tissue. There's a famous story in medicine about a guy named Poor John Hunter. He wanted to see what would happen if he injected himself with syphilis, and then he documented his decline until he could not document it anymore. But yeah, Poor John Hunter. It's a sad story of medicine. Treated early, curable. And also a note of caution. Some folks who may have a collagen vascular disease or autoimmune disease can have false positive tests on the screening test for syphilis. So if you're told you might have syphilis, don't panic. Get the more confirmatory testing. Hepatitis B. Again, this is a common sexually transmitted disease worldwide. It is usually through sexual intercourse, although you can get it from fomites, as we discussed earlier. This is one of those more hardy viruses that can be picked up through other means besides just sex. But it does, it's an inflammation of the liver. You have flu-like symptoms. You turn kind of yellow, and it can promote more chronic debilitating conditions of the liver. There is a vaccine for hepatitis, so that's, I think all of you probably have to have it, right, to enter college. But you should be aware of it, but most of you are probably immune to it. And HIV, the big kahuna of all the STIs. Fortunately, when I started my training in medicine, this was a death sentence within 6 to 12 months. Now it's a chronic disease due to all the research and antivirals. But still, anybody who's sexually active in America has some risk factor for contracting HIV. Of course, knowing your partner is important and their habits. Somebody who's within the drug community or is an active user of drugs, even if they're not an IV drug abuser, they may be cavorting and having sexual contact with ones who are. So it's a condition that attacks your white blood cells and makes you compromised to fight off infection. So it's important to get checked every year when you go to the doctor. I advise patients to get checked for it just because it's always best to be safe rather than sorry. And I think I'll end it there because HIV, again, is a whole nother talk. But that's a great question. The question is, after age 26, the HPV vaccine is not recommended. And the answer is the original studies that were done, the population was done on women 26 and under. That's the only reason. I suspect going forward that we will expand the age group who can get the HPV vaccine, but the FDA is very stringent upon they only approve the vaccine for the original population that was studied to get FDA approval. So going forward, because once in a while I do get a question from patients who've never been tested positive for HPV, hey, can I get the vaccine? My own personal practice pattern is if they want it and I don't have a good reason not to give it, I will allow them to get the vaccine because I see it doing no harm and it could help. But there are ongoing studies to see if they can expand the age group, but it's not technically not indicated after age 26.